Okay, this video is welcome to residency, okay? So I'll show you where this is coming from. This is about, I got this idea from this lady here. Her name is Sara Stanchik, and this is a very good book. She wrote, What's Missing from Medicine? She was diagnosed with multiple sclerosis when she was in residency, about 30 years of age or so, and she became progressively debilitated. She initially went down the path of conventional medicine, and her health just kept getting worse. She was in a wheelchair. And then she started seeing articles like, multiple sclerosis isn't always present in identical twins, therefore it's not primarily genetic. And certain diets seem to help a lot. And then she, went low-fat vegan and she got better. So a rather remarkable story. But one of the things I recall from the book is she said that being a USA conventional medicine resident taught her how to be unhealthy. So here's the things that she pointed out. She says, in residency, you're overworked, so you become sleep deprived, bad for your health. You're stressed out, they give you too many patients in too little time. You have to go faster than you want. You're not happy with the quality of your work, but you have to do it just to survive. Going fast is what it's really all about the farther you get in medicine. Okay, so she said then everybody starts drinking a lot of coffee. They're caffeinated, stressed out, sleep deprived. They start eating a lot of processed food. They're always in a hurry. The drug reps often bring the fast food, the junk food, the processed food. You get it from the vending machines. The old joke at Cook County Hospital in Chicago was you eat, for surgical residency, how you survive. You eat when you can, you sleep when you can. Only give out minimal information. Lie, cheat, and steal in the interest of the patient. Don't mess with the pancreas. It's unforgiving. So it's sort of a brutal survival type of lifestyle. And so I would add a few things to that. Also, the residents are taught essentially that diet is irrelevant to disease. They're also taught that it's normal to be sick. Everybody gets sick. I knew a lot of my attendings, the senior physicians that teach the young residents in the hospital, they were fat and sick, okay? That was very common, that they had hypertension, diabetes, coronary artery disease. You're also taught that nobody knows why. It just happens. Even if you do everything right in your life and your habits, you're probably going to become fat, hypertensive, and diabetic. That's just the way people age. Of course, smoking is bad. Being an alcoholic is bad. Being an IV drug addict is bad. Being obese is bad. But, it still happens even if you don't do all that stuff. That it's essentially inevitable to be fat, sick, and later on stupid nowadays as you get older. There weren't as many demented patients back in those days, but there still were plenty of them. Okay, the older doctors, like I said, typically are fat, hypertensive, and diabetic, sort of the motto of like an internal medicine-based residency, family practice, or whatever was match the ill to the pill and send a bill. Same thing with the fellowships for internal medicine-based fellowships. In dentistry, it would be drill 'em, fill 'em, and bill 'em. Okay, a medical license was, essentially a license to sell prescription drugs, to be a drug dealer. Big Pharma was the ultimate gang leader, but, you're basically a drug dealer. Okay, I never heard of diet causing disease or epidemiology reasons why some populations are healthier. So basically what I'm saying is med school is basically training to be an internal medicine doctor. Internal medicine and internal medicine subspecialties basically teach you to sell drugs. You never learn about diet, epidemiology, toxicology, any of the stuff that's really important and related to curing a patient. So anyways, I think that's good to realize. So the only way you're going to bounce out of this is you become aware of, Bruce Lee, the great martial arts fighter, he says, if a person doesn't realize they are walking in darkness, they are unlikely to ever see the light. And that's been my experience too with lots of these conventional doctors. They just pretend this is all normal, and a lot of them are fat and sick. And so unless a person realizes there's this alternative universe out there of nutrition, epidemiology, toxicology, they never learn it and they never cure anybody of these chronic diseases. So it's doable. The causes of these chronic diseases are totally knowable. They're totally avoidable for the most part. So anyways, I thought that was a little bit interesting, a little bit funny.